Diabetes is a collection of diseases that involves the way our body processes glucose or sugar. Glucose is necessary for all of our cells to function properly so that our muscles and tissues, including our brain, get the energy that it needs. There are three types of diabetes. Type 1 diabetes, which prominently affects those who are younger age, teenage, adolescents. And this involves the inability of our pancreas to produce a hormone called insulin. Type 2 diabetes generally occurs later in life after 40, and this involves when our cells is unable to process glucose properly. The third type of diabetes is gestational diabetes, and that is when the body's hormones produced during pregnancy make our cells more resistant to insulin. What is the typical progression of diabetes as it relates to eyesight? As it relates to eyesight, diabetes can progress in a variety of different ways. Sometimes the first sign of someone having diabetes is that they come in with a huge change in glasses prescription. This is a result of an increased sugar in the lens part of the eye, causing a change in that glasses prescription. There may not be any signs other than that within the eye at this point in time. However, the longer one has diabetes and or the longer it's left uncontrolled, the greater chance that there is for diabetic retinopathy to develop. Diabetic retinopathy is one of the leading causes of blindness here in the United States. Diabetes makes blood vessels throughout our body more leaky. When this occurs, this impairs the ability of the blood vessels to get the nutrients to their designated locations of tissues and organs. When it occurs within the eye, in the particular area of the retina, which is like the internal screen of the eye, it is called diabetic retinopathy. There are two forms of diabetic retinopathy. There are the non-proliferative diabetic retinopathy and the proliferative diabetic retinopathy. Non-proliferative diabetic retinopathy can range from mild to severe. The most severe type of retinopathy is proliferative form because it can lead to retinal detachments and permanent vision loss. In all stages of retinopathy, you can have swelling in the central portion of your vision, which is responsible for you seeing details, reading, all those sorts of things. If this happens, it's a result of the blood vessels in that area becoming leaky and damaging those cells in that area, resulting in a reduction of your vision. Diabetes is most common among those who are overweight and over 40. While it's not completely understood why this happens, it is very clear that the cells become resistant to insulin and therefore cannot intake the glucose it needs. One theory as to why this happens is that the extra weight one puts on puts extra stress on the cells, therefore dampening the insulin's receptor's ability to uptake the glucose.